Hi my teammates. I'm so happy to meet you today. I am Mahmoud Al-Kholi. And here is our presentation. We will review together the Angioblock trails. Let's start it. First one to review is the inclusive trail, which is one we can call efficacy trail. This trail was published in Journal of Hypertension at 2005. In this trail we review the efficacy and safety of irbesartan hydrochlorothiazide combination in lowering blood pressure in grade 2 hypertensive patients. The inclusive trail design was a multi-center, prospective, open-label, single-arm trial. It was done upon 844 adult subjects had uncontrolled systolic blood pressure. The mean systolic blood pressure was 140 to 159 mm mercury. The treatment was sequential and betrayal start placebo was given for 4 to 5 weeks. Hydrochlorothiazide 12.5 mg was given for 2 weeks. Then irbesartan hydrochlorothiazide 150/12.5 mg was given for another successful 8 weeks. The persistent uncontrolled patients was given irbesartan hydrochlorothiazide 300/25 mg for another 8 weeks. Mean changes from baseline to treatment end in systolic blood pressure and diastolic blood pressure were assessed. Irbesartan hydrochlorothiazide treatment regimen achieved systolic blood pressure goals in more than 75% of patients uncontrolled on monotherapy. It decreased systolic blood pressure by 23 mm mercury and diastolic blood pressure by 11 mm mercury. So we can say surely that Angioblock is effective hypertensive lowering agent. The second study we have today is the real-world efficacy analytical study. Let's get more details about it. It was published in Clinical Therapeutics at 2011. It is a retrospective analysis of real-world efficacy of angiotensin receptor blockers versus other classes of antihypertensive agents in blood pressure management. It is analysis of the Southwestern Ontario database of 170,000 adults their age greater than 18 years with hypertension persisting with antihypertensive medication for more than 9 months. This post-hoc study showed that irbesartan had the highest control rate with 48% compared with other ARBs. Valsartan and candesartan show 42% control rate. Losartan show only 41%. On the adverse effect irbesartan shown 40% lower adverse events compared by other ARBs. So Angioblock achieves the highest control rate and less adverse effects compared with other ARBs. The last trail today is albuminuria trail. Let's get more details about it. This trail published in Clinical Drug Investigation at 2004. We can call it the protection trail. In this trail we can see the role of irbesartan in regression of microalbuminuria in type 2 diabetics after switch to irbesartan treatment. It is a multi-center, open, prospective, observational study done for 6 months upon 38,016 patients at 9,838 general practitioners' offices throughout Germany with microalbuminuria in type 2 diabetics. The main trail aim is to determine the proportion of patients with albuminuria at baseline and at 3 and 6 months. The proportion of patients with positive albuminuria was decreased by 28.3% after 3 months and by 49.6% after only 6 months. The result was great as 86% of patients achieves their blood pressure goal. The mean blood pressure decreased by 23 mm mercury systolic and 12 mm mercury diastolic. Irbesartan treatment over 6 months reduced the proportion of patients with microalbuminuria from 49.2 to 23.2% with relative risk reduction, 52.8%. So we can surely say that Angioblock is the ideal approach for diabetic hypertensive patients. And here is the points we agree today: that Angioblock is effective antihypertensive, and it is also tolerable for patients, and it gives renal protection for diabetic and hypertensive patients. Thanks for your time.